Thank you so much, Dr. Mehmet, for your kind introduction. Thanks, Dr. Ali, for your impressive presentation. Good morning, everyone. My name is Dr. Mehmet, Assistant Professor of Pharmaceutical Sciences here at AIB and former Fulbright Scholar at the University of Texas at Austin. Glad to be with you here at AIB. So today I'm going to talk about the applications of 3D printing in the treatment of bone cancer, or what is known as osteosarcoma. So before we start, what is osteosarcoma? So osteosarcoma is a kind of cancer that affects bone tissues. And almost 700,000 new cases are diagnosed every year. This disease affects both adults and, most importantly, kids. And only less than 2/3 only of affected kids can survive this disease. And as any other kind of cancer, the economical, social, and psychological burden associated with this disease is extremely high. So, what are the challenges with the current treatment available for osteosarcoma? So, osteosarcoma is treated, the bone cancer is treated by two different successive stages. Stage number one is surgical removal of the tumor from bone itself. And this surgical operation is so extensive to leave negative margin after removal of the affected tissue to decrease the chance of bone cancer recurrence. And as you can see, or as you can expect, this in most cases will lead to disability of patients. So patients will not be able to use their limbs again after this extensive surgical removal of the affected tissue. That's why during this surgical operation, we need to substitute the moved bone. And we have three different approaches to substitute the moved bone. So this can be substituted by metallic biodegradable implants. And actually, this is not the best choice because putting metals inside bone tissues will cause some inflammatory reactions and some reactions that can be received by body. And actually, this metal stents needs to be replaced every several weeks. So this will expose patients to several surgical operations. Okay, so we have other options. Also can be replaced by bones from other parts of the same body or from another volunteer. This is called autograft or allograft. And also this is not the best choice because this will subject patient to cross-infection, especially with this lower immunity of this kind of patient having bone cancer. Also, we have a third option, which is called bone substituting material. So after removing bone, we can fill or substitute the removed bone by what's called bone substituting material. So what is bone substituting material? Simply, it is a material which mimics the bone structure, very similar to the material used in tooth filling, very similar to this material. But unfortunately, all these options will not provide a chance for bone elongation or bone growth, especially if you are talking about kids, because kids they still have a chance for bone growth. So bone can divide and blood vessels can grow again. So imagine that you are putting a metal in your bone. So this will block completely any chance for this bone to grow. And also new blood vessels or new cells will not be able to divide. Okay. Actually, this is the first stage of treatment only. Okay, so what is next? Next stage is post-operative chemotherapy. Usually we use doxorubicin systemically administered, and actually we administer this chemotherapy at very high doses. Can you guess why? Is this a special type of cancer? Yes, because the low blood perfusion to bone. So the blood perfusion, the blood flow to bone, very similar to the blood flow to your teeth. It is very low. That's why we need to administer aggressive high doses of this chemotherapy. And of course, this will lead to the common systemic side effects of all chemotherapy, like vomiting, constipation, hair loss, and many other symptoms. Okay, so these are the current challenges of post-treatment. Number one, no chance for bone regeneration, bone elongation, extensive surgical operation, and excessive side effect due to the high dose of systemic chemotherapy. So unfortunately, after all this long journey of treatment, harsh journey of treatment, After all this, recurrence of the cancer may occur again. Why? Due to the low efficiency of these chemotherapy. So actually, you will have high concentration of the chemotherapeutic agent in your blood, but the concentration of this chemotherapy in bones is very low. That's why there is very high chance of recurrence. Okay, so our objective is to overcome these two challenges. Number one, we need a bone substituting material that will allow regeneration of bone, allow angiogenesis and osteogenesis, division of new bone cells, and elongation of the bone. This is number one. Number two, we need to deliver the chemotherapy with the maximum concentration in bones and lowest concentration in bloodstream. Why? To avoid these side effects, right? So these are the main two objectives of our research. Yes. So how can we achieve this? Okay, let's talk about the first aid. So here comes the role of 3D printing. So we use 3D printing technology to design a scaffold, to design. So to design a scaffold from the bone substituting material, which is made from technically from calcium and phosphate. It is the same material of bone. So what are the advantages of 3D printing of these scaffolds that will replace the removed bone? Okay, number one, this scaffold can be personalized and tailored according to the individual. So we can design a scaffold that will exactly fit the cavity after bone removal. This is number one. Number two, this material is osteoinductive. The material itself is osteoinductive. What does this mean? It will induce the surrounding stem cells to differentiate and to proliferate into osteoblasts, new bone cells. Number three, we can control these pores, the porosity of this scaffold. And this is the most important thing here. Because these pores is very critical to allow the growth of new blood vessels through this scaffold. Without these pores, we will not be able to induce what's called angiogenesis. And this property is called osteoconductivity. And we need an optimum pore size between 300 and 400 micron. And this can be precisely and accurately designed using 3D printing. And also we can control the mechanical properties of the scaffold itself. So we don't need this scaffold to be, we need this scaffold to be impact resistant. So we can control the mechanical strength of this scaffold by controlling the porosity and the infill density of this scaffold. Moreover, this scaffold is biodegradable and resorbable. So after the growth of new bones, this material will disappear. Okay, so there's a good chance of recover to the main shape of bone, especially if we're talking again about kids. And moreover, this scaffold, due to its porosity, can be loaded with stem cells. So this also can be used for adults. So if you don't have a chance for bone growth, no problem. We will incorporate stem cells loaded inside these pores, of course surrounded with optimum biochemical environment to support the growth of stem cell, and this is called osteogenic. Okay, so how does this work? Okay, look at the next slide. So here is this slide just showing you how can we tailor or modulate the mechanical property of the scaffold by controlling the porosity and the infill density, and as you can see. Quickly also, as you can see, controlling the porosity can make this scaffold match the surrounding bone tissue, because the density and porosity of bone is not the same. As you can see here, any bone, the central part of the bone is spongy and porous, and the outer part is more compact. That's why also we can tailor the porosity to match the surrounding tissue of bone, so it will not be rejected, and this will make life easier with this scaffold. So how does this work? First of all, we will do what is called 3D scanning of the defected area. So after surgical removal, we'll do what is called 3D scanning using a special camera. Then we will send this 3D scan to computer. Then we will use simply a very simple software. Most of these software are available free online. So we'll use special software to design the scaffold itself. Then, after getting the design, which is optimized for the best mechanical properties, the best porosity, this will be sent to the 3D printing equipment, our machine, and then we get our scaffold. Okay, looks nice, right? So now we got a scaffold that will replace bone, and it is biodegradable, and it will induce bone regeneration and bone elongation. Okay, so what about the second objective? So where is the chemotherapy? Okay, so we have decided to load this scaffold with chemotherapeutic agent. So we will not give chemotherapy systemically. No, we will load this chemotherapy inside the scaffold itself. That's how we will maximize the concentration inside the affected area of bone. We'll have the maximum concentration inside bone, and guess what? We will have the minimum concentration in blood due to the same reason, because blood perfusion is very low. So drug will not reach in your systemic circulation, and that's how we will
Low side
avoid
effects.
systemic side effects. But actually, that was not enough for us. We need to maximize the uptake by cancer cells. So we didn't load doxorubicin directly into the scaffold, but we encapsulated doxorubicin into nanoparticles. So we put doxorubicin, the chemotherapeutic agent, into nanoparticles, then loaded these nanoparticles onto our scaffold. So why did we do this? To increase uptake by cancer cells and to protect the normal mesenchymal cells in bone. Actually, we have compared several nano carriers. I will not spend much time here. So we prepared what's called the span elastics, artisan called the span elastic, and of course liposomes and albumin nanoparticles, and we carried out extensive comparison of all these systems by testing, for example, the cytotoxicity against osteosarcoma cell lines in G63.
Technology.
And we found that span elastic and artisan called span elastic shows the greater uptake or the greatest uptake and cytotoxicity toward osteosarcoma cell line. So why especially span elastic? Because span elastic they have unique property of being elastic and deformable. So as you can see here, these kind of nanocarriers can squeeze easily and penetrate the phospholipid bilayer of cancer cells. Okay, so this also was verified by updated study of this nanoparticle. By the way, doxorubicin, a drug, is an orange drug and it is fluorescent. Doxorubicin, if you know, it is orange and fluorescent, and it can be easily monitored by any fluorescent microscope. So we performed an updated study using 2D culture and 3D culture, and we observed very rapid uptake within 1 hour, almost full uptake of doxorubicin by the cancer cells. Okay, so one more challenge here is that the release of doxorubicin couldn't be sustained more than 24 hours in all these systems. Do you think 24 hours is enough after surgical operation and implanting this scaffold? So do we need to sustain the doxorubicin only for 24 hours and this will prevent recurrence? I don't think so, right? That's why we have decided to go one more step. We will not incorporate the vesicles directly into scaffold. We will put these nanovesicles in a cross-linked gel. So we will surround these vesicles with gel, cross-linked like alginate gel, cross-linked with calcium, for example. Then we achieve prolonged duration up to 7 days. Okay, 7 days of doxorubicin may kill any remaining cancer cell. Okay, then we came with our final design. So the last design here we came with a final design of what is called cage-like scaffold. So as you can see here, so here we have a cage-like scaffold made from calcium phosphate cell, and the core here is filled with gel loaded with nanocarrier loaded with doxorubicin. And you can see the bottom and walls is from calcium phosphate cell, the white material, and it will be covered with calcium phosphate cell, but a cage-like structure. And by the way, we were challenging ourselves during this printing to test the printability of this material. This scaffold is as small as 6 millimeters. And we need to adjust the distance between these strands to be between 300 and 400 micrometers exactly, because this is optimum for angiogenesis. And guess what? We performed scanning electron microscopy, and we found that the distance between these strands is exactly in the target range between 300 and 400 micrometer optimized, and we were able to achieve this distance precisely. And again, this scaffold was as small as 6 millimeter. Okay, the last thing here, the last thing. So we want to make sure that our system is cytotoxic only for cancer cells, and it will not kill the mesenchymal stem cells. So we want to make sure that our system is safe for normal cells, but toxic only for cytotoxic. So we have good news here. We performed another study comparing the cytotoxicity against NG63, which is the osteosarcoma cell line, and human mesenchymal stem cell. And we found that our system was more cytotoxic to cancer cells and keep our stem cells safe. As you can see, this was also verified by electron microscopy. And as you can see here, we observed active attachment of the stem cells on the scaffold. Attachment and spreading. This ensures the viability of the stem cells. So the stem cells are viable. Compared to, for example, number FD. FD is observing the cell attachment of after addition of free drug. So getting free doxorubicin, in this case, the stem cell will not able to attach and spread, means that it is dead. So as you can see here, it is actively attached and is spreading, ensuring the viability and safety of our system regarding that stem cell. So, in conclusion, in our system, using 3D printing technology, we could overcome the main challenges of the available treatment of osteosarcoma. So number one, we will personalize the scaffold to exactly fit with patient. Number two, we will achieve maximum concentration of the drug in bones, avoiding systemic side effect. We could achieve prolonged and sustained release using the cross-linked gel. We can tailor the mechanical properties of the scaffold itself, and of course, we are decreasing the dose, and most importantly, decreasing the cost, because most of chemotherapeutic agents are very, very expensive. And these are the references, if you want to check these references, and that's all for now. And if you have any questions, please feel free to ask a question. And this is my LinkedIn profile, more than welcome to connect. Thank you so much.